Hello, everybody. We're glad to welcome you at our webinar with medical professionals, where we show how Inobitec DICOM Viewer can be used for surgical planning, education, as well as improving the diagnostic results and clinical outcomes. It's been a while since our last show, but it was worth waiting because the guest we have today is a progressive neurosurgeon and one of our most devoted and experienced users who has been mastering Inobitec DICOM Viewer Pro for more than 5 years. Please welcome the beast of segmentation, Dmitry Okishev. Hello, Dmitry. We're glad to meet you.
Hi, everybody. Thanks for your invitation. I will be glad to share my knowledge, my experience with current and potential users of Inobitec software.
You're welcome, Dmitry. As well as being a talented neurosurgeon, Dmitry is a technically minded individual who enjoys experiments and innovations. It is well known that you pioneered the use of 3D printing for neurosurgery in Russia. Now I see some printers behind your back.
Yeah.
How does the lab in your background benefit you? Would you mind telling us a little bit more about it?
Not pioneer, but one of first, okay. For sure, yes. It was kind of a pilot project that we launched several years ago. When we started using Inobitec, we quickly realized that the path from segmentation to 3D printing is relatively short, was surprisingly short. And we bought our first 3D printer. It was center-free. And like many others, we start printing surgical models, prototypes for preoperative preparation to enabling tactile interaction of what we see on the screen. And currently, after some time, we have developed and patented some techniques and devices in field of surgical guides, molds, and some other things. I have prepared several slides for you. Can I show it about 3D printing?
Yeah, you're welcome. Please. That sounds very interesting. We would like to see some of these samples.
Okay. In our small lab, we have several 3D printers, FDM printers, mostly for prototypes and molds, and SLA printers for surgical guides. Currently, there are biocompatible resins for surgical guides that could be steam sterilized after printing. Here you can see the process of modeling and printing of a complex anatomical model. All anatomy was segmented in an Inobitec DICOM Viewer, and printing was performed using two-nozzle 3D printer. Two-nozzle 3D printer allows us to print with Salubi supports, and we have the possibility to dissolve with Salubi supports just with water. You can see that this model is from polylactite, and with supports, with Salubi supports from polyvinyl alcohol, PVA, and it is easy to remove it, just to place this model in water. And with such techniques, even with FDM, we can make such tiny structures like nerves, like arteries. 3D printing is very helpful in modifying dynamic titanium meshes. With such little fragment of 3D printed skull, we can perform all manipulations with titanium before surgery without spending intraoperative time on it. And when we can make this implant using SLM printing from titanium powder, even such complex defects could be closed using the described technique. For craniotomy for hyperostotic meningiomas and or other pathology infiltrated the bones, we can use surgical guides, and I can say that this technique have higher precise than even neuronavigation. This is our technique, this is our method for PMMA implant creation, polymethyl methacrylate. Initially, we print, as we called it, metamolds. Then we fill it with liquid silicone, medical grade. And after hardening and after steam sterilization, it could be used for PMMA implant creation intraoperatively. Here you can see metamolds filled with liquid silicone. This is silicone molds after hardening, and this is final view of implant. For this case, the resection of hyperostosis was performed using surgical guide, and after that, in the same anesthesia, it is important. This individual implant was performed using metamold and fixed with titanium planes and screws. You can see that this implant consists from convexital path and with elements of lateral wall of orbit and orbital roof. We can use segmentations with printing of such individual craniometric rulers. And we even wrote an article about this topic. It is free accessible. We can share the link in the chat. I think this is very helpful too. This is about our FDM and SLA printing techniques.
That was really great. Thank you very much for your demonstration, and I must congratulate you with the results you've reached so far. I hope you will continue developing these ideas, and I am so impressed with the technology that enabled you to save a lot of time for the treatment planning for the patients, and I'm impressed that your technical mind invented this craniometric ruler. That's really great. My congratulations, Dmitry. I would also offer to move to the demonstration of some practical cases. I would like to ask you to perform some demonstrations on the program. And before we start, I would like to tell a couple of words about the software that we're going to use today on the demonstration. It is called Inobitec DICOM Viewer Pro, and we've developed this software especially for advanced medical diagnostics and image processing for the quality treatment planning. There is a wide range of extended tools, among which is 3D reconstruction and segmentation. You can find the link to the program trial in the description below. We will leave it the link there. Dmitry, the stage is yours. I will ask you to start the demo.
I would like to add a couple of words about how we finally ended up using Inobitec software. I work in a neurovascular department, and my department deal with different types of vascular pathology, aneurysms, brain AVMs, and maybe you know that the best way how to diagnose vascular pathology is CT angio. And we started using Inobitec DICOM Viewer to make such simple voxel 3D reconstructions based on CT angio using standard color tables from different programs from your program. I have one case. I can show you about it. Can I start my screen demonstration?
Yeah, sure.
This is Inobitec DICOM Viewer version 2.15.1. And here in Inobitec DICOM Viewer, we have very useful feature. We have the possibility to open studies directly from zip folders. I very like it. And here we have CT angio with 60 milliliters of contrast injected. We can open this study, and we must do it to take a look to native series. But to properly analyze it, we need to use one of this type of reconstructions, MPR reconstruction or volume reconstruction, or even both. I prefer to use MPR reconstruction due to some additional possibilities in this tab. And with tab, we have the possibility to activate MIP render, maximum intensity projection, which is very helpful to analyze vascular pathology, for example, thickness 10 millimeters, okay. Here you can see pericallosal aneurysm. Here in MPR tab, we have the possibility to place markers on standard place. It could be point marker or, for example, line marker. And all these markers will be synchronized with 3D. Yes, here we have the possibility to activate 3D window just in MPR tab. In 3D, as a first step, we need to adjust via level a little to visualize results. Then we need to crop the scene with, for example, clipping box. Or with polygon cut. This is direct polygon cut. Or we can use inverse polygon cut. You can see a pericallosal aneurysm here. Or we can use the tool designed for segmentation already. I mean brush cut. Here we should activate the brush cut. And we need to adjust the size of this brush, pressing Alt and moving your mouse back and forward. And after some little tuning, we have 3D reconstruction of our approach in such positions that we will have intraoperatively. It is very helpful. And after some time, when we use an Inobitec software, we learned about the segmentation and started using it. With segmentation, you can make very accurate 2D and 3D representation of individual anatomy. And I have several cases for you. Another thing, in Inobitec DICOM Viewer, there is very useful, very important feature. I mean, of course, layer fusion. With layer fusion, you have the possibility to use several sources for your reconstructions. Patients often ask, for example, what is better, CT or MRI? But we know that CT is not better than MRI, and MRI is not better than CT. In fact, both methods have its own advantages. CT is better in seeing brains, in seeing bones with the destruction, for example, and MRI is better in seeing brain structures and brain lesions. And you know that MRI could be done in many different ways, many different types of MRI. And for some diseases, it is necessary to use several sources for your reconstructions. And in Inobitec, we have the possibility to use several sources for our reconstruction via layer fusion tool. I have several cases. Can I show the first case?
Yeah, sure. While you opening the studies, I would like to admit the work speed of the rendering on 3D reconstruction, even having such kind of old-fashioned video card. The rendering is quite fast.
Quite enough. Here I have GTX 50. This is quite old video cards, but it is quite enough. It is quite enough.
We work a lot on the optimization of the performance because we would like our users to run the software on a great scale of the devices.
But it is better to have a graphic card with VRAM, video RAM, 8 gigabyte or more for layer fusion.
Exactly.
Here I have the patient with sphenoid vein meningioma. Here we have MRI after gadolinium enhancement and CT scan. And on MRI, you can see well visualized tumor. But we know that this type of tumors often infiltrate bones, so we need to analyze CT. And on CT scans, we can see, one moment please, bone infiltration here. But we don't have well visualized tumor due to absence of contrast enhancement. Let's fix this issue using layer fusion. First step is we need to choose the primary series, the series that could be the base for our reconstruction. The spatial coordinates of this series will become the spatial coordinates of all our reconstruction. I prefer to use CT scan for this case. Let's activate layer fusion tool, series fusion, okay. Then we need to drag MRI series and drop it to the center of this tab, and then click NPR. Now we have two studies in one tab, in one NPR, but in different spatial coordinates. We need to co-registrate two different studies to make an alignment between MRI and CT. And here in Inobitec, we have different types of alignment, different types of layer fusion. With points, manual alignment, or in the most of the cases, we just need to press one button, merge layers automatically. And after some correlation, we will have two well co-registered study in one tab. Done. Okay, MRI and CT, CT and MRI. But in some cases, it is needed to make a little help for the program to make manual layer fusion a little. You can move this layer. You can rotate this layer pressing Alt. And after that, next time, click Merge Layers automatically and correlate it. Okay. For bone reconstruction, I suggest to use volume model. Let's tune it a little. We level, crop the voxel cloud. Maybe we need to cut all voxels except this object, for example, for better performance. And for tumor visualization, I suggest you to segment this tumor using NPR tab, using NPR layer. First step, we need to make a new structure using high intensity thresholds. Then we need to adjust this mask. Now threshold is 1700 or a little more even. And after that, we need to fill this mask, fill this tumor with voxels using one of appropriate instrument. But before this manipulations, I prefer to decrease the opacity of this mask to fully transparent for better visualization of anatomy. Then let's fill it with voxels, for example, using brush restore. Pressing Alt, we have the possibility to change the size of this brush, or for example, using region growing. I prefer to use region growing. And brush cut, of course. Now we have tumor and bones. For better visualization, I prefer to wrap this voxel cloud with surface here. And sometimes it is very helpful to tune off voxel cloud and make the surface transparent to see all adjusted structure. Like in previous case, we have the possibility to make virtual craniotomy, but here we mustn't open frontal sinus, and the surface we can use surface for mark our frontal sinus. We should wrap with bones with surface, then tune off voxels for bones and make the surface a little transparent. Now we can see frontal sinus. Let's mark it with markers here and here. Let's continue our craniotomy. Without opening the frontal sinus. Having CT angiography, we could reconstruct all major vessels just at the tumor, but this is not the case. The resection, the bone resection in this case should be more aggressive. Here, from here to superior orbital fissure. To inferior orbital fissure. To middle cerebral fossa. Here till the channel of maxillary nerve. And sometimes we even need to resect anterior clinoid process.
Dmitry, can I ask you, why do you need such an aggressive opening?
This is not an opening, this is a resection of the tumor, because tumor infiltrate all these bones.
I see.
Okay, I have done with this case.
Yeah, we can move to the next one. Feel free to do this.
Okay, next case. Next case. Another interesting feature in Inobitec DICOM Viewer is PET-CT analysis. Here you can see PET-CT analysis, but this is an additional feature, and you have to pay some extra money to activate it in the program. But if you're not a radiologist and you don't need to calculate all that indexes of radioactive agent enhancement, maybe it will be enough for you to view PET-CT just using layer fusion too. Here we have the studies, CT study, PET-CT with methionine enhancement and MRI. PET-CT scan. Here we have CT series and series with after methionine intake. This is one series, so this is two co-registered already aligned between each other series. Let's use this series as the base for our reconstruction. Activate layer fusion plus methionine series plus MRI, triple fusion for this case. MPR. Slice distance too large. It is okay. 1.5 millimeters. It is okay. Next, let's make an alignment for MRI, and let's tune it off. For methionine layer, for methionine series, let's choose the right color table, for example, PET blue, and adjust transparency a little. And now we have PET-CT. Of course, this is not enough for radiologists, but maybe it will be enough for neurosurgeon. And we can tune off CT layer here and tune on MRI layer, and you know that MRI is better in seeing brain structures and brain lesions. Now we have synthetic MRI, very rare study. Maybe it will be helpful for someone to multiple glioblastomas.
Yeah, that looks really great. You can move to the next case, please.
Next case is about a patient with trigeminal neuralgia. Trigeminal neuralgia, in such pathology, patient has very intense facial pain due to compression of trigeminal nerve by superior cerebellar artery. Here we have MRI with 3 series, include Fiesta, and Fiesta considered to be the best to diagnose such pathology. But distinguishing the exact cause of compression could be very challenging. Is it superior cerebellar artery, or the branch of superior cerebellar artery, or even vein? Let's find an answer using layer fusion too. And what series should we choose as a base for our reconstruction? Fiesta is limited in high, like time of flight series, and on time of flight series we don't have well visualized brain structures, so let it be T1 gradiented series FSPGR, gradient echo series. Very fast sequence, I very like it. Okay, let it be the base. Activate layer fusion plus 3D TOF plus Fiesta MPR. This is one study. All our sequences are already co-registered between each other. And the next step is optional, but I want to demonstrate it because this is very useful. In Inobitec DICOM Viewer, there is fast and simple way how to extract the brain and brain structures. First step is add a new structure for MPR layer for T1 without gadolinium enhancement, which is very important. We need to adjust our mask to outline GUI. We need to double this structure, and I want to use, for this case, I want to use watershed segmentation. Watershed segmentation allows us to divide all this voxel cloud between several structures, but we need to assist this type of segmentation with segment markers for each structure. For example, structure 1 will be, for example, brain. Okay, let's place several segment markers for this structure. Frontal lobes, parietal lobes, temporal lobes, thalamuses, brainstem, medulla oblongata, cerebellum, and this structure for the rest of anatomy. ICS, soft tissues, muscles, cartilage, superior sagittal sinus too. Let's try. We need to press this button, watershed segmentation. Yeah, okay. Press OK and enjoy results. The segmentations here is not correct, but we can place additional markers and recalculate this scene better. Now let's turn off all these soft tissues. I prefer not to color the brain and brain structures. Then we need to choose appropriate color table for this situation. I prefer tissue. And adjust level a little. Now we have the brain and brain structure extracted. For this case, we need only brain stem, maybe cerebellum. Let's crop this segment. Let's hide all structure markers from here. And in many cases, I prefer to cover this voxel mass with surface, to wrap with surface, cover with surface. Let's cut all voxels except objects. Here we have brain stem, bones, trigeminal nerves. We need to make separate segmentation of trigeminal nerve, I think. Let's add a new structure and adjust the threshold. Brush restore, adjust the size, pressing Alt. Mm, for yellow color for nerves, for trigeminal nerves, or for optic nerves, for example. Cover it. Okay, now we have brain stem, pons, and trigeminal nerves. And for vessel visualization, I suggest you to use just volume model from 3D TOF. This volume model. Let's crop it, and we need only structures adjusted to nerves. Adjust in level. Let's wrap it, cover it, and cut all except objects and color it red. And here you can see conflict between left-sided conflict between branch of superior cerebellar artery and trigeminal nerve. That means that this is surgical situation. To check our reconstruction, we can use the third layer in NPR, Fiesta. Let's turn off NPR for T1, for 3D TOF, voxels. Here we have NPR layer from Fiesta, this surface from T1, this surface nerves from T1-2, and vessels from 3D time flight series. You can see that all structure is well aligned, well co-registered. That's why our reconstruction is correct. And this is really surgical situation.
Yeah, that looks really impressive. I wonder, how did you manage to do this kind of job before you had such a technology?
Yeah, it was kind of magic. Intuition.
That looks great.
Using our intuition.
You must have been great on that. Perfect. Shall we move to another case?
Oh, of course. For sure, I use Inobitec DICOM Viewer for cranioplasty too, to view bones, bone destructions, especially if some bone infiltration, especially if some resection is needed. In most of the cases, in I think 80% of cases, closing of unilateral defect is needed, and it could be achieved using skull mirroring. And in Inobitec DICOM Viewer, we have the possibility to make mirrored series, relatively fast technique. To do it, we need to open the study. Here we have CT scan with patient for cranioplasty. You can see. We need to open this study. Then we need to click with button, flip image horizontal. Then we need to save with flipped series using this little arrow or key combination Control E. Create a new series, mirror it, entire series, raw image data, okay. Now here we have two series, original and mirrored one. Let's fuse them. Plus mirrored series. Click MPR. Activate 3D view. Let's tune off volume models for each layer, and let's make bone segment for each layer using high intensity threshold. For bones, it should be from 100 to 200. Let it be 150. For this situation, I prefer segmentation from point by mask. This is the original skull. And this is mirrored skull. Let's color it pink, for example. And now we need to have an alignment. But we need to unlock layer frame of reference for the mirrored series, and then let's try automatic merging. Okay, but not perfect, because in this situation we have rotated vertebrae, and for some cases it is needed to make an alignment not using the whole series, but only segmented structure after excluding from the structure some asymmetric elements, for example, vertebrae, like in this case, or drainage, or shunts, or some bone fragments, maybe. Let's crop these vertebrae. And after that, let's try to make an alignment using this structure. Better. Now we need to delete, to erase all unnecessary voxels for our mirrored skull. I prefer to switch to parallel projection for cranioplasty planning.
Looks inch perfect.
And now we need to export all these segmented bones outside the Inobitec DICOM Viewer to make all manipulations in other programs. I prefer Blender. Maybe we can use Freematic for modeling, for example. To do this, we need to make surfaces to cover these voxels with surface, and then let's export this surface to desktop.
Which format do you prefer to use for this type of export? You work mostly with STL?
I prefer STL because this is very universal file type. This file type I can open in any program.
You mean CAD program, right?
Okay, I have done with this cranioplasty, and I have implants already performed in Blender with STL for titanium printing, SLM printing from titanium powder, and this one is for PMMA implant creation using our Multimodal technique.
Oh, so both of them you've made manually in Blender, right?
Right, right. I prefer Blender. I have done with my cases, Igor.
Every one of them looked pretty impressive, but the last one is like my personal top.
So Inobitec DICOM Viewer is perfect program. I can recommend it for neurosurgeons, for radiologists, for maybe endovascular surgeons too, for engineers, medical engineers. Absolutely great soft. And thank you, Igor. Thank you for your team for development of such excellent program. I'll try to do my best to investigate all these instruments, all new instruments, and I look forward to see about new features in your program. Thank you a lot.
You're always welcome, Dmitry. It's an honor for us to have such a devoted user, and I personally admire how you play with the program, how easily you combine the tools, and how you invent different strategy on how to segment and save time on segmentation. And all those implants that you make, they look really great, really great. Thanks a lot, and thanks a lot for all these demos. We will post all the links that you described during this webinar in the description to the video, together with the media channels of Dmitry, like YouTube channel and Telegram channel, Neuro 3D. We'll post the link in the description. So thanks a lot. You've been great, and
Thank you.
yeah, see you soon.
And thank you for your
Bye
team.
bye, Dmitry.